DRG stimulation is a stimulation modality that's similar to spinal cord stimulation in that you always get a temporary trial first for a week before you proceed with a permanent implant. The difference is that the hardware is smaller in diameter, so the electrodes are just a millimeter in diameter, and they're placed along the early portion of the nerve root just as it's exiting the spine. And this is the one area of the nervous system where all the sensory fibers, all those nerve fibers that transmit pain sensation and other sensation are nicely coalesced together, packed together, and we're able to stimulate all the sensory fibers with this electrical stimulation device. And so an electrode with 4 separate contacts are placed along that nerve root, initially for a temporary trial period for a week, to stimulate the painful area of the extremity. And as I mentioned before, it is a more effective stimulation modality when it's compared head-to-head with spinal cord stimulation. And so once you respond to the temporary trial, then 2 weeks later or so, you then get a permanent implant where myself as an interventional pain physician would make an incision, one at each level for the electrodes to be inserted, and then a separate incision where the electrodes are connected to an implanted pulse generator battery that then drives the system to provide sustained long-term pain relief. It's something that can be removed at a later point in time if desired, just like spinal cord stimulation. So there is that reversibility aspect to it. But it's a minimally invasive procedure. In order to make the incisions for the electrodes, they're usually a 3/4 inch incision at either of the electrode levels that you're going to position. So let's say hypothetically in the low back for the L4 or the L5 lead. That's a common application for somebody who's having lower leg or foot pain. And then you make a separate 2-inch incision in the low back to connect the electrodes. These are all done as an outpatient procedure. And within a week to 2 weeks, you're recovered from that procedure. And then you need to go through a course of physical therapy or occupational therapy in order to upgrade your functional status. Because once we've cut this pain down in half, one needs to improve your ability to walk. Many times people have adopted a abnormal gait pattern because of the nature of the pain. And so you need to go through that physical exercise training in order to improve your ability to walk for longer time frames and the like. This has been a very gratifying treatment modality in order to improve patients' lives because we have these advances in our armamentarium of pain treatment options now, much more so than when I was in the early part of my career. That can make a meaningful difference in someone's lives. And so when you take that type of individual who feels like there's no hope, and you then apply this treatment of DRG stimulation, and you get them back to a point where they can jump back into life again. And so I've seen people get back and finish their training and education, their social lives improve, and then move on with other aspects of their lives. And so that's so very gratifying to see that you've been able to make a difference in someone's lives where before that, they simply didn't have any real hope.